Welcome to a discussion about concussion. I'm Geoffrey Lauer with the Brain Injury Alliance of Iowa, and I'm here today with Jill Miller. Jill is an advanced registered nurse practitioner in neurology with the Physicians Clinic in Iowa. That's in Cedar Rapids. She's also an expert in concussion recovery and management. Jill, thanks for joining us.
Thank you.
We're here today to talk about the concussions that kids have, and then the portion of kids that don't recover as easily as others. So a concussion may cause a child or any person to feel initially dazed, confused, have a headache, or may lead to difficulty concentrating. Are there symptoms that are less typical that pop up and that you see when you deal with complex situations?
Sometimes we do see other things. Dizziness tends to be one that comes in a lot. Dizziness, ringing in the ears that we've had patients complain of, speech issues, cloudy thinking, or difficulty retaining information. So they can go back to school, and what I learned that day, I go to use it that night on my homework, and I can't recall it. So some of those things we see as well with the headaches, the light sensitivity, sometimes sound sensitivity, that can also harm, or I shouldn't say harm the child, but make it difficult for the child.
So 70% or so of kids will recover within the first 4 to 6 weeks from concussion, but that still leaves 30% that don't. Are there symptoms that seem particularly common for that group of kids that don't recover within the first 4 to 6 weeks?
The most common one is headache. Continued headaches. The other ones that we see tend to be a little bit of the fatigue yet, and then the concentration, the focus, the attention, and then the mood, the irritability.
Oh.
This isn't my kid, he lashes out, or this isn't my kid because he just flies off the handle. And it's those type of things that we see as well.
So let's talk about headache as a common symptom. Is that a kind of a headache that you can just treat with Tylenol or ibuprofen, or how do you suggest people manage headache?
Typically, it's the headache that doesn't really want to go away. So it's multiple days a week that we're having a headache. Sometimes they're waking up with the headache. Sometimes it's they're waking up and they're going to bed with that same headache, and it really hasn't let up. It may have gotten better in the severity where I'm not a 9-10 out of the pain scale. I'm more of a 4-5 or a 3, but it's still there consistently. Occasionally we'll have it where maybe it's 2 days a week, 3 days a week. And sometimes when it's 2 days a week or less, treating with your over-the-counters, your ibuprofen, your Tylenol, is definitely reasonable and works well. When we're getting to the point that you're getting up to 3-4 days a week of a headache, then we get concerned about what we call rebound headache, where then you're gonna end up in this constant headache because you need the ibuprofen to make it better, but it may not go away, or it comes back as soon as that ibuprofen wears off. And then we start to have to manage that differently with maybe daily medications that they can take to help to try to prevent and decrease the severity of the headache. We also sometimes use supplements. There's some good supplements out there that we'll typically use. They take longer to kick in, but they can be very beneficial.
What would be an example of a supplement that you're talking about?
Supplements we usually use are riboflavin. Another name for that is vitamin B2. Magnesium is another good one that I like to use in some kids, just because I think some of it is you're not going to have side effects with these. They're not harmful to the child. Where when you start talking prescription medications, it gets to be a little scary for parents.
Thank you. That's helpful. So what other options that you or other healthcare professionals commonly use to manage the symptoms such as the fatigue? Are there medications or behavioral programs that can deal with kind of that extended just tiredness after a concussion or a mild brain injury?
Yeah, so we try to work with the schools, especially because that tends to be when we see the fatigue become bothersome, is when they're in school. So maybe working with the schools to let the child, if symptoms are starting to escalate, the headache's getting worse, they're getting fatigued and they can feel that coming on, can they go and lay down and rest? 20 minutes. 20 minutes of just laying down, resting, and kind of turning the brain off tends to reboot them. And then they can maybe finish the day. Instead of sending them home and not finishing a day of school, this way they can still finish the school day and still be there, be present.
Many kids, when suggested that they take a break and go lie down, I have kids myself, the frequent answer is, no, I'm okay. So what I hear you saying is that kind of a 20-minute break might refill their gas tanks. And so it would take, in this case, at school, it would take educators recognizing that. How do you communicate back and forth between parents typically in schools? How's that best done?
We typically try to write a letter maybe from that day's visit and send and try to fax it to the school or give it to the parent if we can, to say, okay, this is what needs to be done, and try to help with that. Sometimes we have nurses reach out to us, and so we'll let them know what's going on from that standpoint too, which kind of makes it easier for the child that way too.
Got it. Are there any other symptoms, such as the memory issues that can have different kinds of treatments or suggestions from you?
Yeah, so with memory is always a tough one.
Yeah.
A lot of times we try to get them in with the occupational therapist because they can give them a lot of good ideas and recommendations to help with memory. A lot of times it's note-taking. We'll even write letters to the school about letting them record lectures so that they can
audio
record lectures so that they can go back later that day and know what was talked about. If it's one that the teacher is going off of PowerPoint, letting the child have the paper version so that they can sit down and write their notes on that, and it's all connected.
Over the course of the last maybe even 20 years, the ways that we've thought about and responded to concussion, mild brain injury, have changed significantly. Do you find that parents or families come in with ideas that may be no longer current, that you have to re-educate? Are there common things that, I know when I was younger, there was a belief that you should wake a child up every hour over the course of the night. That's not really standard of care anymore. But no. Are there other characteristics that you see people bringing in?
Some, I would say too, is just completely taking them away from everything, isolating them, putting them in a dark room,
cocooning them.
Yes,
that's no longer.
Which is no longer as well. And we do get a lot of, I woke them up every hour. Mm-hmm. No, that's not something we're doing either. We need to let the brain rest, but you also need to be using the brain as well.
Got it. So that's really helpful. What about the belief that you can have a certain number of concussions before you have to worry? Is there like a concussion bank that kids can use and save concussions from one sport to another?
I think they wish they could.
Yeah.
But no. And that's, I think, the hardest part too, is that there's not really any research out there to say, is it one concussion that's bad? Is it 10 concussions? Mm-hmm. And, I think it comes down to is how much it takes for you to have a concussion compared to what it would take me to have a concussion. Mm-hmm. Everyone's different. Mm-hmm. Females are different compared to males, and we're noticing that. Some of it is maybe the symptoms. Females tend to maybe have more of some of the headaches and some of the fatigue. I tend to see a lot more of the males have a lot of the moodiness, the irritability, the headaches as well. I think females are a little bit more apt to tell someone about their symptoms than some of the male athletes, and I think it's more, you want to be tough, you want to be strong. Right. I don't want to sit out football, but there's that risk.
So that might suggest also that parents, especially with young male athletes in this case, to watch behavior a little bit more vigorously, because there might not be the same amount of volunteering that headache is there. Many athletes that I've known, and when I was younger, there's a push to want to play, mm-hmm. and so that's still. What about age difference? So there's the potential for a young child to have a concussion, maybe playing on the playground at age 5 and recovering. But if there are behaviors that emerge maybe a year or so later, is there ever a reason to look back and wonder? Is there a relationship? Do you ever see relationships between earlier concussions and later concussions or later behaviors?
There is. You wonder about that, just with even like attention focus issues, mm-hmm. because maybe the kid can do really good, they suffer a concussion, you think they've recovered, and they still continue to do well in school, but all of a sudden now we're getting further in school, and it's getting harder, and it's getting they're needing to be able to focus better and concentrate better, and all of a sudden they can't. Well, is it something that they would have developed, or is there a possibility that this concussion 2 years ago maybe was a part of this?
If I was a parent and came into you wondering about that, is that something that you would support me going back to my school and asking for maybe some adjustments for my kid?
Yes, no, I think getting adjustments, even if it's an IEP, a 504 plan, having them sit in the front of the class, those type of things definitely would be very well supported from our office.
Understood. So in the first, say, 3 months after a concussion, what are the top things that parents can do to partner with you or healthcare professionals to really help their kids have the best shot of recovering as fully as possible?
I think the biggest thing is being an advocate. You have to speak out for your child, because I think the schools sometimes aren't seeing those things.
Right.
You know, they're seeing 20, 30 students in their class, and then they're expected to be able to pinpoint out that this kid is struggling. This kid is struggling, they've had a concussion and they're still struggling.
Right.
I think that's hard for some of the teachers to do just because you have so many.
Right.
And so I think being the advocate as the parent and going to the school and pushing, you know, what you need and whatever backup you need, is that seeing a neurologist, is that using your pediatrician, getting that information so that the schools have some documented stuff as well that's coming from a medical standpoint, I think is the biggest thing.
Awesome. Being an advocate, it takes a lot to raise kids these days. Well, thank you.
Thank you
so much for taking time with us. Jill Miller is an advanced registered nurse practitioner in neurology with the Physicians Clinic of Iowa here in Cedar Rapids, an expert in concussion recovery. I'm Geoff Lauer with the Brain Injury Alliance of Iowa. For more information about brain injury, concussion in Iowa, and or for support in being an advocate with and for your kids, you can find more information at iowaconcussion.org. Thank you again.
Thank you.